Okay, we'll call the meeting to order. I think we have an announcement from our Spanish interpreter.
Yes, thank you. Good afternoon. I'm going to go right ahead. Buenas noches y bienvenidos a nuestra reunión. Para quienes necesiten interpretación, este seminario ofrece traducción simultánea al español. Para acceder al canal en español en Zoom, siga estos pasos. En la barra de herramientas de Zoom, haga clic en el icono del globo etiquetado Interpretación. Lo puede encontrar haciendo clic en el círculo con 3 puntos o más. Seleccione Español de la lista de idiomas disponibles. Si prefiere no escuchar el audio original, puede seleccionar Silenciar audio original para una traducción más clara. Para los que asisten en persona y desean un auricular para la interpretación, pueden dirigirse al personal del Distrito 5, quien les ayudará a obtener uno. Gracias y esperemos que disfruten la reunión. Thank you.
Thank you. Let's do roll call.
Okay, Pitt Marquez de la Fonte.
Here.
Vicky Clues.
Here.
Terry Gudowski.
Here.
Spencer Scott.
Here.
Carrie Hernandez. Here. Ty Hilton.
Here.
And I'll note that Joe Rogoff is absent. Betsy Van Dyke is not here. Patty Thayer is not here. She will be watching as a member of the public. And Faye Zamora, our student representative, is going to be watching online.
Great, thanks, Debbie. So we move to approval of the agenda. I do have one change. We're going to move the fifth district update to after West County Services. So Supervisor Hopkins can attend. Does anyone have anything else they want to say about the agenda, or can I get a motion to approve?
Motion to approve.
With and that is with the changes noted.
And then Vicky and
Ty.
you can do it with.
Yeah, just raise your hand if you all agree. Okay, everyone approves. Conflict of interest. If anyone on the council has a conflict of interest with anything on the agenda? No.
Yeah, so I have to recuse myself from any conversation on agenda item 7 today on the social safety net services. A day job work with some of the vacancies. Excited to see Danielle and Chris presenting, but
Está presentando.
we abstain from any conversation.
Okay, thanks. Okay, let's
Muy
move.
bien. Pasemos pues.
We have problem with an interpretation. That was because I was adding the other interpreter.
Okay. So we're gonna move to item 4, which is council member comment on something that's not on the agenda. As always, if you have something to talk about that's not on the agenda, now's the time to do it and make it clean. Anybody?
I have something, but I have to look at it. Sorry.
That's all right.
So we mentioned last meeting, Cynthia Halliday was here from the Hollydale community, and she is forming a code group, which are these communities organizing to prepare for emergencies. And they will be having a meeting on the 22nd of February from 9 to noon at the Hollydale Community Clubhouse.
Great, thank you. Anyone else? Okay, now, anyone that is attending the meeting in the public, if you have any comments that are not on the agenda, now's the time to bring them up.
We do have one hand raised online.
Yep. Becky, go ahead.
Becky.
Hello?
Hello?
Can you hear me?
Yes.
Hi, so sorry about that. The not on the agenda item, just trying to get FYI to Ms. Hopkins, is she there today or no?
We will be later in the meeting.
Okay. It's road related. Canyon Road really took it on the chin in the past storms, just trying to get some work done so it doesn't continue to erode with respect to water mitigation and crumbling under the asphalt. I don't necessarily want to take up your time with this. I was just hoping to try to get her ear.
Great, and I would recommend that you talk to whoever your council member is on that as well, because they can relay that information.
Thank you so much. Is that you, Vicky?
Yes. And I know
Okay.
about the issue. Thank you.
Okay, thank you.
And I'll also send you an email message or a message for someone on our staff to get in touch with you.
Oh, thank you.
All right, great. Anyone else in the room online? Okay, we're gonna move right to West County Services Center, for a little presentation, and after the presentation, we will do some question and answer. We'll go to the council first. And then we will go to the audience for questions.
And they're 5 separate organizations,
Right.
so you can line them up in order on the agenda, however you.
Who wants to go first? How's that? Speak now.
I don't think anybody wants to go first, but I'm
Yeah.
willing to.
Okay, go ahead.
Just-
Yeah, you need to stand up here so we can see you on the camera.
Okay, my name is, and this is my colleague Stephanie Kopp. We both work for Sonoma County Human Services. For both of us, we work in the Employment and Training Division. And we have become part of the West County Services Center, along with some of our colleagues in the Economic Assistance Division. In the case of Stephanie and myself, we represent the cash aid programs of Sonoma Works or CalWorks and General Assistance. And Sonoma Works specifically is for families with children under the age of 18 in the household, and General Assistance is for families that need cash assistance that do not have children in the household or individuals, not families. Stephanie currently is the person that is in the office out here in Guerneville Thursday afternoons, 12:30 to 5. And she's helping folks that come in and apply for either of those programs, either help them with applications, answer questions, either applicants or people that are currently recipients of those programs, with occasionally the capability of making appointments and getting people through entire intake interviews out here. Our colleagues in the Economic Assistance Division will be manning the office on Tuesday afternoons, same hours, 12:30 to 5. And they'll be answering questions for folks that have questions about Medi-Cal and CalFresh benefits. Again, helping to complete applications, et cetera, for them on Tuesdays.
Great, thank you. We'll go one by one. If there's any questions for each presenter, council, anyone? Yeah? No? Anyone in the public have any questions?
You repeat the hours.
Sure. So the hours that Human Services will be there will be Tuesdays and Thursdays from 12:30 to 5. Specifically on Tuesdays, Economic Assistance will be helping with Medi-Cal and CalFresh programs. And then on Thursdays, the Employment Training Division will be assisting with Sonoma Works and General Assistance.
Great, thank you. All right, do I have another volunteer to go next? Otherwise, I'll go down the list.
I'll go for.
Okay. Thank you.
Hello, my name is Aurelia. Let me have Tracy pull up your slides. Oh, Tracy, this is the WIC presentation, if you don't mind sharing the screen. And then as well, good information for anyone who wants to take the through though.
And the site will be available. Right,
Yes, they were in the packet.
Yep.
And so they are available online.
yeah, that's right. It's more.
Yeah. Yeah, but now your screen isn't showing. It showed for a second and then it disappeared. Oh, here it comes. There it is. Okay.
Okay, so my name is Riley Alvarez. I am one of the community health workers at WIC. So Sonoma County WIC has 4 different sites, which I'll be going over in just a bit. That's just the introduction slide. Location for, and then.
Can you project your voice to this microphone here? It's for our interpreters.
Okay. And other nutrition assistants. Okay, next slide. We can actually go to slide 3. So WIC is a nutritional program that aims to safeguard the health and well-being for women, infants, and children. So the children are from the ages 1 to 5. And then the next slide. So part of our WIC services are not only nutrition education, which is what we're fairly known for, but also breastfeeding support and promotion, lactation support in general for mamas who are combo feeding as well. We do give referrals to other health and community services. So if we don't know someone else at WIC will. Healthy foods, and then also we have our annual farmers market in July and August. Okay, next slide, thank you. So this is part of what we do. I just put a little bit of the WIC fruits and vegetables. That's one of like our most well-known things, because in the past, pre-COVID, it was about $11 per month, and there's been changes to $26 per month for children ages 1 to 5, $47 per month for pregnant and postpartum individuals, even if you're not on. And then $52 per month for fully and or partially breastfeeding. And then, so this is the criteria. We won't go super into depth, but basically for any pregnant mamas or those that just had a baby, breastfeeding or non-breastfeeding. So as I mentioned, combination or fully formula feeding mamas are more than welcome that way. Infants and children up to the age of 5, and then also partners of or grandparents, foster parents, or their partial custody or going through those types of things are more than welcome. Working migrant and military families, and then most families that have active Medi-Cal or CalFresh or participate in CalWorks do typically qualify. We do not ask for or require Social Security, nor do we ask about citizenship status or anything like that. So it is not considered a public charge program. That's something that we get a lot of questions about. So something to consider for our families. We're worried about that. Okay, and then these are the 4 sites. So Santa Rosa is one of our sites that is open Monday through Friday. There are others, like in Greenville, it's twice per month at the moment, every 2nd and 3rd Thursday. And then we do have outer clinics in Petaluma and Sonoma as well.
So is the 2nd and 3rd or 2nd and 4th?
Or 2nd and 4th, sorry, yes, 2nd and 4th. At Petaluma and Sonoma, their hours do change a little bit because we do have later days where we have hours until 6 or 6:30 for families that have like a tighter work schedule. And then that's our phone number. So that is a general phone number for the Santa Rosa office. And for more information or to see if families are eligible, they can go online and answer the questionnaire and the criteria on there as well. And then the last one, there's also, we go more into this at the first time appointments, but there is an application. Like the app is a lot easier to kind of navigate what the needs are. Before it was more like the checks, now it is a card. So that is something that a lot of families have had in user time. Any questions or concerns at all?
Council members? Public, any questions? Anything online? All right, thank you. Okay, anyone want to volunteer next? I'm gonna name names.
So now that our participants are online, so we
Yep.
have Charles with Department of Health Services Behavioral Health. And then we also have the other one are 3 together, Aaron, Danielle, and Chris are all talking about Keep People House. So there's 2 more topics.
Yeah. So does anyone want to volunteer to go?
We're happy to go. This is Chris from COTS.
Okay, go for it.
Hi, excellent to see everybody. And Ty, good to see you there on the screen. Yeah, so my name's Chris. I'm the CEO with COTS. We're in Petaluma. We've got Aaron Kruger also with COTS and Danielle Danforth with West County Community Services. We'll just give you a quick overview of the new homelessness prevention program called Keep People Housed. We launched on December 16th. There are several organizations involved. COTS is the lead organization with various providers throughout the county. In this area, West County Community Services, we felt was the best provider. They knew the community best. Everybody knows Danielle. We know Danielle really well, and we trusted her to do this work really, really well out there in West County. This program provides short-term financial assistance for households who are on the brink of losing their housing. The goal of this program is to reduce the inflow of households falling into homelessness throughout the county. It's a lot cheaper to move someone or to stabilize someone over the short term than it is to move someone from homelessness into housing. This is a 2-year pilot program. Again, started December 16th. As of the 31st, just to give you some numbers, these numbers are December 16th through January 31st. We've got over 630 applications. We've already issued over $150,000 in assistance. 266 households. That number is growing by the day. These households, you know, they range from a household of 1 to households of more than 8. So this program is also one of the few programs in the homelessness services sector where it's easier and more cost effective for us to actually serve multi-person households. That is a really difficult thing to do within homelessness services in the county. So we're really, really thrilled with that. I don't want to take up the whole time here. There may be some questions. I'm happy to pass it over to you, Danielle, to talk a little bit more about households qualify and how they can apply for assistance.
Danielle, you're muted.
There we go. How am I now?
Hey.
I was clicking buttons over here. Yeah, so I'm Danielle. I'm with West County Community Services, and there is a website that people go to that's called keeppeoplehoused.org. It takes it to the main platform that's actually servicing 4 different counties. So we're at the bottom one, so you just click on that. When you go to that, it gives you some questions that it starts kind of the process for seeing where you fit on the scale, because this does have some scoring that goes with it. It's called evidence-based practices, so that we can try to get the money out to the most needy people in the shortest period of time. That would be the ones that probably would not self-resolve. So that takes care of the whole county, and then depending on where they are in the county, it vets it to the appropriate partner, as we have 4 other partners that are doing different areas, so that we get the ones that are in our area, and then we contact them from there. So that's the initial site is for the original vetting and scoring and waiting, and then getting them to us. And then, of course, there's an application process after that where more documentation comes in. But that's the short story. You can go to there. You can also come into our office. We have a computer where several people have come in and accessed this right on our computers. We are able to start it in many ways over the phone. If you go to our website at westcountyservices.org, we have a tab on there with our phone numbers, and actually there's a phone number that's dedicated to keep people housed. There's the websites on there. There's also our individual phone numbers that we can be reached at, and the agency phone number. So there's like 7 different phone numbers that people can get one of us somehow, and people have gone down the list, and that's great because that's what it's meant for, because we're all over the place. So that we can, refer them to the appropriate place. I even get calls from other areas and I say, hey, go to this site, or, oh, you're in Santa Rosa, CSN is your folks. So they can call CSN directly or they can go on the site and do it. We're very much a partner in this endeavor. So hooking people up and trying to remove those barriers is really important.
Excellent. Thanks, Danielle. Just a couple more notes for everybody to consider. This program focuses heavily on equitable access. So the questions that the application looks at are weighted scoring based on, equity, making sure that everybody in the community, the most vulnerable, are accessing the program first. So we look at things like disabling conditions, history of homelessness, the zip code where the household might live, and various other factors that would help us determine whether we are helping the most vulnerable households. And those points are added up as somebody submits the application within the system itself, to give us a heads up when we receive an application on the initial kind of vulnerability index of the person or the household who is applying. One thing that we're really proud of that is also a really key demonstration of the need for this program in the North Bay is that this program is also operated in Solano, San Francisco, Alameda County, and Santa Clara County. When you're talking about the counties with the large cities, Oakland, Alameda, San Francisco, you're talking about a population that's much, much larger than Sonoma County. And despite that, Sonoma County has received far more applications in the first 2 months than any of those other communities. So, we did I think, a really good job doing outreach to reach community members and let folks know about this program. But it also demonstrates that there's a huge need for this type of assistance here in Sonoma County. So we're really, really proud of that. And we're really excited to continue helping households. We're happy to take any questions that you might have about it.
Thank you. Council members?
I think I missed this maybe. Danielle, so you're in the Guerneville office?
I am. I have my main offices there. The people that are the service staff are actually at the 3rd Street house, the healthcare for the homeless house that's kind of kitty corner to our back door. So that's where their office is. And of course, we all do a lot of remote work these days too, and all over the place from the cars or wherever. But our main offices are in Guerneville.
Do you have hours there or is it the usual all the time?
All the time. All the time.
Thank you.
Someone else have a?
I don't know if you addressed the total number of dollars that are going into this program over 2 years, but do you have that figure?
Yeah, that's a great question. So this is a public-private partnership. So there's money here from the County of Sonoma, the City of Santa Rosa, the City of Petaluma, and then there's a large chunk that is privately funded by a nonprofit called All Home. They are headquartered in the East Bay. So the public funding portion is smaller than the private. The private funding is $2.6 million, and the remainder is all public, and it is total over 2 years, $3.9 million. And then COTS is working really hard to fundraise additional private funding to keep this program going beyond, that 2-year pilot period, because we're already seeing the effectiveness of it.
Any other council members have a question? No?
Can I go ahead?
Yeah, you mentioned the other counties, but I didn't get them all. Can you repeat them, please?
Yeah, so it's Solano County. They are the most recent one other than Sonoma. And then we've got Alameda County. So that's Oakland, the County of San Francisco, and then Santa Clara County.
Okay, great, thank you.
Anyone in the public have a question?
Can I ask a question?
Oh, yeah.
So we have some folks that come into our offices at the West County Service Center that are monolingual Spanish speakers. And what kind of support services do you have for language access?
That's a great question. I will give you a quick note on that. Let me pull this report back up. So far what we're seeing is between 16 and 17% of households do require translation or interpretation services. All providers that are working in this program have bilingual staff.
Great, thanks. Anyone in the public? Yeah.
I was curious how you measure like long-term success of the program. Are you going to look at the point in time count year over year? I've mentioned people involved with this rate. I'm just curious, like, how do you look at kind of long-term sustainability of it beyond just the people, actively signing up, if that makes sense?
Yeah, that's also a great question. I think it would probably take more than 2 years to see this work accurately reflected in a pit count. I do think you will start to see that, assuming this project can go beyond the 2-year pilot period. But internally, the collection of data that we're doing we are surveying all households that receive financial assistance at 6 months, 12 months, 18 months, and 24 months to determine if those households are still housed after receiving assistance. Our goal there is that 90% of the households that we actually issue financial assistance to will remain housed. And it's, I say a good thing with quotes. It's a good thing that we do have that 10% that kind of fall into homelessness, because that demonstrates to us that we really are helping people that are right on the brink, and that without our help, they would have fallen into homelessness. So that's where that 90% measure comes from. So hopefully that answers your question. We'll see what happens with the pit count, during the pilot period.
Thank you.
Anyone else? Great, let's move on to the next, which is gonna be Charles, I believe.
Hi, my name's Charlie. I'm a health program manager with Sonoma County Behavioral Health. I manage the CMHC programs, which are the community mental health clinics. We have offices in Cloverdale, Petaluma, Guerneville, and Sonoma. So we're a program that's designed to serve the outlying areas, so essentially everything other than Santa Rosa. We serve clients all the way up at the Sonoma County line with Mendocino County, and all the way down to Marin County, all the way east. We have a team of therapists, non-licensed case managers. We have a psych nurse who actually travels out in the community and helps people with their medications and delivers injectable medications on site. We have a peer provider part-time, which we're really excited for. That's a new opportunity in our program. And we have several psychiatrists. So we provide psychiatry, case management, which is really kind of the bread and butter of what we do as an agency, which means we help people access services, we help people actively participate in services. We deliver these services in the community, in people's homes often, which is much different than some other agencies that deliver services to folks that aren't suffering quite as much. We also offer therapy. So our target population is folks with what we call severe and persistent mental illness. So that would be people with bipolar disorder, schizophrenia, PTSD, and then any other diagnosis that really leads to a significant impairment in their lives. People that struggle to work, struggle to attend school, struggle to kind of do the things that they want to do. So we differ in a sense that the services we provide are much more intensive, and we have access to some other more extensive support in the community with county partners. We partner with all of the federally qualified health clinics in all of our service areas to serve folks that are more in the mild to kind of mild moderate range. And our goal is always to step folks down. Our goal is to help people feel, the best they can, and then get them down to a lower level of care. So the large majority of our clients also struggle with a co-occurring substance use disorder. There have been some really, really great changes in healthcare law that allow us now to serve people with only a substance use disorder. We used to be divided as an agency, but now we are one and the same, which is really exciting. I've never seen somebody who has only a substance use disorder, so we really see people as kind of a whole person and serve both struggles in the same way. So for folks to access our services, they would contact our Sonoma County Behavioral Health Access Team, which is the entry point to mental health services for the entire county. They have a physical location off Challenger Way in Santa Rosa, which is our main behavioral health campus. They share the building with the Crisis Stabilization Unit, or anybody, family members, clients themselves can contact the access team. I can put the number in the chat here. Thank you.
Thank you. Any council members have any questions? No? Public? Any hands raised? Oh, yeah. Oh, go for it.
I'm curious, I mean, I know that, you know, mental health, substance abuse issues are the big drivers of, you know, people who are homeless. I'm curious if there's any like interaction between the last two programs that we heard from, any collaboration, or how folks that are, you know, in one program might access the other.
Yeah, certainly. So we, as an agency, we collaborate with pretty much everybody in the public service sector. CMHC is, so we have a homeless services division in the county that would probably collaborate more with COTS. We work with COTS quite a lot as a program, as the CMHC program, but our homeless services division would likely be collaborating with COTS more. We certainly work with West County Community Services. We actually shared, we were office partners, I suppose, in the Guerneville site. So we have tremendous appreciation for the work they do, and have always enjoyed partnering with them. Yeah.
Great, thanks. Anyone else online?
I don't see any hand raised on the hand.
Great, thank you guys so much.
Yeah.
Thank you.
Thank you. Okay, let's move on to 5th District updates. Is Supervisor Hopkins?
Is not on yet. I can do the staff update.
Okay.
There were 2 reports in your packet. There have been some questions. Some of the representatives have been getting questions from people about the governance study. So I included a report about where things are. If anyone has questions on those, I can certainly answer questions, or you can just take a look at it and use that to respond to public questions.
Can I make a comment on that?
Absolutely.
Because I can't check. One of the most important things for, I think, council to remember on the governance study, which is a critically important study that happened, is that a lot of questions that we get are, why isn't the MAC holding meetings about this or talking about this more? The simple answer is that we are basically an extension of the government, of the Sonoma County government. And so you can think of it would be a conflict, right? So we're part of the government, and so we can't really influence it as a group. Individually we can, but it really is up to the public. And so encourage people that want to know about it to actually read about it. And if they want to do a district for utilities or water or whatever they may, for a business district downtown Guerneville or downtown Forestville, form a group, talk to a couple of people, see what's involved, and do it. And then you can bring it to us and let us know what you're up to. But that's really the question we get the most is, why aren't you doing anything?
And this decision was actually made by the ad hoc when we met in following the government study, that we itself to come forward with whatever ideas or plan.
Right.
Well, and the whole council
Right.
talked and voted on the conflict issues. So.
Yeah.
Yeah.
Sorry, Debbie.
No, you asked for this information. That's what you need. And one of the other questions that came up is how can I sign up to, stay in the loop? There is a way for people to sign up for it. The link is in there on the governance study website, so people can, express interest in staying in the loop. They can also express interest about particular, solutions, governance solutions that are of interest to them, and then we can help put people together who are expressing similar interest. There is a form on the website that.
And
people
also
can
to
use.
identify which of our neighborhoods somebody is saying, I'm gonna be involved in
Right.
Forestville or Greenville or
And
whatever.
so we can help
Pass
make
along.
connections.
Yeah.
Yeah, right. So that was one, question that was coming up a lot. The other question that was coming forward where people were, are wanting to know how to stay updated on the sidewalk project in Guerneville. And, Jay had actually, I didn't even I asked him for an update and he sent me this update. Caltrans is doing this on a regular basis, weekly updates. And you can sign up for the Guerneville Chamber newsletter and they're sending it out weekly. So, anybody who wants to stay in the loop on what's going on can sign up for the Guerneville Chamber and, stay in the loop.
That's funny. 'Cause I got a couple questions from chamber members. Why are we kept in the loop? Goes to show you. Anyway,
Tell them to sign up for
Yeah.
the newsletter.
or read it.
So that's what I have on that, and then, the other, just because Supervisor Hopkins, I don't think it's online yet, let me take a look. He is not, so the one thing that I wanted to, just talk about a little bit is, this most recent storm that we had,
The one today or? the-
no, the baby storm, we're here, aren't we? The one a couple of weeks ago, right, the early February storm. And so the Board of Supervisors did, do an emergency proclamation of a local emergency, and they activated, a contingency that, that provides for eviction protection during the emergency. So, that's currently countywide. That was the way it was written and their ability with the ordinance how to do that. But they're bringing it back at their next meeting to more fine tune it for the areas that were impacted. But, so folks are protected from evictions, during this time. And we were finding that people were coming into our office and very concerned about that. And then at our last meeting, or the meeting in December, after the November storms, we had Department of Emergency Management and Public Infrastructure here. And they took a lot of your all feedback and incorporated that into this
Yep.
mechanism.
A
So you
lot more alerts.
Yeah.
for sure.
yes, so, they're really being responsive and they need to hear from people. There is a flyer on the counter over there. There's a QR code on it. It's been pushed out, through social media. I think I emailed it to all of you. But really, they're trying to collect information from people on their experience during the storm. So if you could get that out to people who have experienced any damages or, loss of work or just anything, so that we can make sure that people are getting the information that they need.
Well, just a couple things to add on that, mostly on them listening to what we have for. I do want to express my gratitude for them doing that, number one. Number two is one of the things they changed was the alerts go out earlier now based on a 32-foot prediction versus a 36-foot prediction. So I think it's up to all of us, because I got a lot of, why are we getting so many alerts, right? It's up to all of us to communicate that out to our neighborhoods and our communities to let them know that's why you're getting more. So they don't freak out because they're getting more alerts, so anyway.
That alerts are happening at a lower level.
Correct.
Right. And then another thing, I don't know if, many of you have seen this, but there's a pilot program to have camera on Green Valley Road, and public infrastructure is live streaming that on YouTube. You can watch it. So just wanted to let you know that's not exactly in the lower Russian River, but it's a pilot program, and just keep in mind spots that, you know, as this program moves forward, where we might want to have one of these cameras so that we can have eyes on them. And they had to rescue somebody from Green Valley Road today. Yes. So. So that's all I.
Okay, thank you. Then we're gonna move to the consent agenda. I know the agenda's a little weird, but, just need to approve the January 9th minute. Does anyone have any corrections or make a motion to approve?
Debbie, did you make a correction?
I made the one that you,
That I was here,
that I.
on fine.
What did you got here? I'm sorry.
Oh, that was.
That was the last one.
Okay.
It was, you did have, it was on the public comment. I didn't.
Oh,
it was
yes,
something wrong.
yes.
It wasn't posted.
Non-serious,
Yeah.
yeah, okay.
Anyone else have any adjustments, corrections? So can someone move to approve the minutes with the adjustment we just talked about?
So moved.
Like the move. All in favor, hand raised, great. Ad hoc committee discussion, there's no, well, actually, does anyone want to talk about communication and engagement?
Yeah,
Go.
we've met.
Oh, okay.
We had a meeting on February 10th, which was like Monday, right?
Yeah.
Okay, good. So what we're doing, it basically is going through the current communications, and engagement plan, making changes to it. Carrie's been super helpful because she's coming in with very fresh eyes. And we're trying to get it to a more reasonable length, and also talking about what kind of methodologies we can use this year to get people more engaged in events, and looking at things like flyers and posters and things like that. So we've started the conversation, but just sort of got through some of the edits on the plan itself.
Right. I have two. Oh, go ahead.
I kind of have a question around how, as Greenville doesn't have an alternate, how are we reaching out? And I'm actually curious how you heard about the MAC, being heard, being interested in it.
Yeah,
It's all super fun. I emailed Joe. I was curious about the governance kind of process. Like my partner and I moved here about 7 months ago. We heard about it, and I'm like, this seems interesting. I don't know what the right answer is.
There's usually more
I'm
people.
curious about it.
Yeah.
Go ahead.
Got it, okay, yeah. How are we reaching out about alternate positions on the, things like that?
It's in the newsletter,
Okay.
every newsletter,
Yeah.
but you know, that's,
You are.
there's a lot more that can be, yeah, there's a lot more that can be done, and I think, for talking, and I know Betsy has been talking to people, we've had some people where their interests have been piqued and, you know, just hasn't happened, so just do talk to people.
Yeah.
And I think that's the best way, let people know as you come across them.
I got pulled in by somebody who used to be there when the first week I moved to my house. So just by walking the dogs and chatting.
Yeah. Amazing.
So I have two things. One of the things that we've been thinking about is in the ad hoc section of the agenda that we potentially could publish in the agenda the meetings that the ad hocs are having. So the reason for that is that people know that something is actually going on with these ad hocs, and it's not just, we're not talking about it, but there's ongoing information. I don't know how anyone feels about that.
So the upcoming meetings,
Or the
or
meetings,
the schedule of our meetings, or,
yeah.
yeah, okay, I think that's great. No, I'm an issue with it.
Does anyone else have a issue with that?
Makes perfect sense. Yeah.
Anyone in the public have an issue with that or want to talk about that? Okay, and then the other thing is, we talked about for land use that we may form ad hocs based on certain circumstances and certain things that are going on in certain neighborhoods. We do know that there is a cargo container storage facility for personal storage. They can, potentially plan for Pocket Canyon.
Yeah, it's for, yeah.
And I don't know if. After Betsy, since you're in Pocket Canyon or any of the Burnville reps, if you're interested or think we need to have an ad hoc about that particular, permit. that's-
Where is?
I don't think it's,
Where is it?
I think it's still in Forestville. Yeah, it's Forestville.
It's
It's
described in the
96.
application as.
Yeah, it's still within the
It's-
Pocket Canyon. area. Yeah, it's village, it's way.
So or Phil rep or whoever. I don't know.
No, it doesn't.
It doesn't have to
Pocket
be,
Canyon reps, it could be Forestville and Pocket
Yeah.
Canyon
Yeah,
reps that are interested.
which might be.
I'm interested in.
Yeah, yeah.
Well, does it seem, I mean, does it seem like it rises to the level of having an ad hoc? So
Well, I'm new to all this, so I would say that I'm interested in two reasons. One, just to see how committee works with land use. And then,
Well, this would be like.
right, that's right.
Yeah.
That was that
Yeah.
one tick box. And then the other is that I am interested because it seems to be a commercial endeavor. And I'm, along that corridor, so to speak, what's going on. And I just did a very quick read of the application. And I think I'd appreciate for my own edification, having an ad hoc just to clarify intent and use, if that's something that we do when we look over it, we come with a question.
Okay. Anyone else interested? Did you raise your hand, Betsy? Or-
Oh, yeah.
I'd be.
I'll play.
So we have an ad hoc.
Okay,
So
Harry, Betsy and Todd.
correct. And so let's get
our first special land use law.
a motion to approve an ad hoc on land use on this storage facility. We'll do that first. So all in favor?
Did we, so. To double check, so let's do it.
Let's
this
just
way
do
for
it.
the purpose. But I think as the chair, you can just.
I know.
So be it.
Yeah, I know.
But so who is the first?
But since we're here.
Yeah.
Storage.
And seconding, I'll second. And Carrie is second.
Alright.
Okay.
And everyone approved? Okay, we'll just go through it anyway. And then you've got people on the ad hoc.
Yes.
Yes.
So we'll pull together because it's not a standing committee.
Correct.
We can do this virtually on Zoom. So I'll get a calendar request out, we'll get a date and we can have a meeting.
You
And
might
then
want to
you'll
reach
bring-
out to Patty there as well.
Okay.
She had some interest in it.
I will. And should we make an amendment to that if Carrie wants to?
Sure. Can we approve that ahead of time?
We did it for the
Yeah, I'm saying, okay, let's
Well,
just do that
I sort of made it
again.
up.
I'll use my power. Whatever that is. Patty,
if desired. I mean, she is.
I'm sure.
She's texting right now. And yeah.
So- So I would just ask the ad hoc committee on this one.
Patty wants to do it.
Yeah, okay.
This is gonna be our first land use ad hoc. To kind of pay attention to not only the topic at hand, but the process that you need to go through, right? Are you gonna get, like, is this district, your conduit to permit Sonoma? Are you getting the right documents? Are you getting the stuff you need? And then it's not gonna go perfect, just highlight the things that don't work, things that do work, and then we can improve for the next. Right. But you're the guinea pig.
Well, Patty will bring her knowledge. She was the chair of
Oh,
the
okay,
land
yes.
use committee before.
But that was the standing committee, so it's different. Oh, anyway,
But at least she'll have that.
She has the background.
absolutely.
Great.
Okay. With that, guess what, guys? We are.
My dog was in the front.
They don't have a storage stuff.